good? All right, excellent. Well, thank you everyone for coming out and joining us this morning for today's press conference. Today's conference is going to address two separate topics. Therefore, it's going to be divided into two separate pieces. First of all, we are going to be discussing the residents of the detention center that have tested positive for COVID. Sheriff Kimbrough will be discussing that. Then Ms. Williams, the Director of Nursing for the contracted medical services provider at the detention center, will come and address that as well. After they are done speaking, there will be time for questions related only to the residents of the detention center. After that has concluded, then we will address evictions. Assistant County Attorney Lonnie Albright will be speaking to evictions. After that, there will be a time for questions related to evictions. Then if we have any follow-up questions, we'll go with those. And then we'll turn it back over to Sheriff Kimbrough to close us out for today. So thank you again for making the time to be here this morning.
Again, I want to welcome all of you here this morning. I appreciate you taking time to come to this press conference. The purpose of this press conference was to clear a lot of misinformation that is floating in our community. I understand that the pandemic has put a lot of stress on this community. The pandemic has put a lot of stress on this country. I understand there are a lot of concerns. I understand that there are concerns as it relates to the detention center. And I want to address those concerns. I want to give you factual information. I want to give you clear-cut information, allow you to ask questions, and give you the correct information. I was very disheartening when I saw a news feed last week that basically depicted us as to not care or not allow inmates to be treated human. Last week, we decided, with the recommendations of the CDC and the Health Department, that we would test every resident, including the staff inside of the detention center. And during that process, to prevent cross-contamination, we allow the residents to stay in their cells for the 72 hours. But here's what I need you to understand, is that during that time, the residents have sinks in every cell, running water, hot and cold water, a towel, a washcloth, and soap. The purpose for doing that was not to punish anyone, but it was to prevent the spread. As of to date, we have 68 positive tests of residents inside the detention center. There's a population of 575 residents. If you do the math, that's 12%. The national average of detention centers and prisons is 20%. We're actually running below that. The precautionary measures that we have taken, that we have implemented, are the measures that have been given us by the Health Department and CDC guidelines, in addition to one of the leading infectious disease experts in this area. As a matter of fact, I spoke with him on Saturday. He applauded us for what we're doing, the steps that we're taking and what we're doing. Every resident at the detention center, we make an effort to make sure they're treated like human beings, regardless of what they may have been charged with or why they're there. But I felt it necessary to give accurate information to what is going on. The tests are coming back every day from the results, and we're doing precautionary measures to stop the spread. What I'd like to do before I go any further is I would like for our Director of Nursing to discuss some of the precautionary measures and some of the medical procedures that we're taking. As of to date, no one has been sent out to the hospital as a result of COVID. No one. So I would like to introduce to you Ms. Williams, who is the Director of Nursing for the Forsyth County Detention Center.
Thank you, Sheriff. Good afternoon. When we did our mass testing over a 2-day period, we tested a total number of 568 inmates or residents at the Forsyth County Detention Center. As to date, as the Sheriff stated, we have received 68 test results. Those tests are positive. We have received a total of 149 test results back as to date, and of those 149, 68 are positive. We are continuously getting test results in as we speak. We are continuously getting test results in as we speak of the 568 tests that we took on the 2-day mass testing days. 64 of those are negative. And as the sheriff stated, that is less than the national average, which is 20%, so we're at 12% of the national average. Right now, we're waiting on approximately 419 test results to return to our facility. We have not sent anyone out of the Forsyth County Detention Center due to COVID-19 symptoms. So I will repeat, we have not sent anyone out of the detention center due to COVID-19 symptoms. We are doing things to implement or processes that we have placed implementations to prevent the spread of COVID-19, and those things include when patients or residents come into the detention center, they're given 2 masks in intake. When they arrive on their housing units, they're given 2 additional cloth masks. When these patients or residents or inmates, when they lose a mask, when the mask should break, they can also request mask from the officers, and they're given a mask. Each patient, when they come into the Forsyth County Detention Center, they're placed in quarantine for 14 days. So when they are arrested, they are placed in quarantine for 14 days, and they are all tested on day number 5. Every patient is tested on day number 5. We also test patients if they request a test, and we test patients if they say that they are exhibiting symptoms or if they are symptomatic. All they have to do is put in a request, and we will test them due to their request. Each chronic care patient that we have at the Forsyth County Detention Center is given a special mask or a KN95 mask, such as similar to the one that I have on now. When I say chronic care patient, these patients include those patients who have hypertension, other chronic care illnesses such as diabetes, HIV, AIDS, heart disease, etc., those chronic care illnesses, because we know that they stand higher at risk for contracting any diseases, such as COVID-19 and viruses. We have made it mandatory that all of our staff, when they enter the Forsyth County Detention Center, we do temperature checks, as well as they have to have on a mask when they enter into the building. Staff are also advised that if they have a temperature or any flu-like symptoms, that they must remain at home. Staff are advised that if they exhibit any flu-like symptoms, they must remain at home. Along with these things, as the sheriff said, we're working with one of our leading infectious disease doctors in this area, Dr. O, and we're following all of our local health department guidelines as well as CDC, while we're still providing all of the necessary medical services within the Forsyth County Detention Center. We will continue to provide the utmost care for your patients, our residents, because truly COVID-19, we're all in this together. Sheriff, I'll turn it back over to you.
Ms. Williams brought up an interesting point, and I think it's worth mentioning. Today's count was 575 residents at the detention center. Last year, this time, we was tracking about 800 residents. While the sheriff does not have the authority to go through the cell and release people, you go home, I don't have that authority. But what we have done since March is We have gotten with the district attorney, the judges, as well as our population specialists. We have went through the Forsyth County Detention Center since March and identified persons who have low bond or a low risk factor, nonviolent, and have assisted them in getting back home. Today, we have assisted, since March, approximately 500 residents during this COVID. I think that it's worth mentioning that I don't set the bail. I have no authority to set bail to bond. I don't have the authority to release people from the detention center. I think some conversations are frivolous conversations that I choose not to be involved in, and I won't get involved in. But I want you to know that as it relates to the detention center, we take that very serious over there. We take the operation over there very serious. And as Ms. Williams said, we're doing everything according to the CDC, as well as the leading infectious disease expert in this area, Dr. Ohl, because we recognize the spread of this virus is dangerous. We understand that. And we take that very serious because all of us, and I'm sure you know someone or a family member that has been affected, and we have been affected as well. So I will pause right there and allow you to ask any questions before I move into the last part of the press conference. Are there any questions?
When is the mass testing? What dates were those?
The mass testing was on Tuesday and Wednesday.
Yes, sir.
I understand your point that the 12% positive rate would be less than the national average of 20%, but if you're doing the math right, if it's 68 positive tests and you've only received results for 149, isn't that closer to a 45% positive test rate?
No, we did the rate based on the number of persons that are present in the detention center.
Yes,
So, but you haven't received all of the test results
No.
from all of the inmates, right?
No,
But you have received
As
150, and out of those 150, 68 have been positive?
no, based on the number.
We have received 149, and 68 of those are positive.
So that's closer to a 50% positive rate, isn't it?
But the number was based on the number of residents present.
Yes, it was based upon the 568 that we tested.
But
But
out
so,
of the tests received, it would be closer to a 50% positive rate than 12%, correct?
The numbers will probably, I'm sure they will increase once all the numbers come back.
so the 12%, just to be clear, the 12% is 68 out of 575, correct?
68 of,
568
out of, yes, out of
that
the,
have been tested, but you only have test results of 149 out of that 568.
that is correct.
So, but you're basing the 12% on what again?
Of the ones that are positive, right now, our national average in the detention centers is about 20%.
But right now, there are a whole bunch of tests that are still outstanding, so you don't know what those test results will be.
Correct. We do not, we're still waiting.
But as of this moment, we can confirm that 12% of the population has tested positive. As test
Out
results
of
continue
568
to,
that have been tested, although you don't know how many of the tests.
right, but we're not going to posit how many are coming back. Right now, we can only confirm that 12% are positive. That number will be adjusted as we receive more test results.
But again, that's only based on 149 test results that you received out of the 568 that you have had tested.
We are waiting on the rest of the test results to come in, and so the 12% is what we can say is currently positive. We will adjust that number as more test results come in.
But of the tests done, 149 tests, 68 have been positive.
Yes.
That would be closer to a 50% positive rate, correct?
If you look at the numbers in the way that you're calculating, that's about 50%. Yes, if you look at them based on that. But the way that the math was done was based on the 575.
Thank you.
You're welcome.
Are there any other questions for me?
What is your name?
My name is Mrs. Williams. I'm the Director of Nursing.
So Williams, W-I-L-L-A-M-S. What is your first name?
WILLIAMS.
And your first name?
Is that okay? I'll give
If
it.
you want to. If you
Okay.
want, you can
I just go by B Williams,
Okay, and what is your title again?
Director of Nursing. You're welcome. I saw a hand. Yes, sir.
Yes, Justin with Channel 12. Quick question for you.
Yes, sir.
Do you have any idea in terms of the timeline of vaccines? I know it's fairly early. We know the state is getting the second allotment of Moderna this week, or excuse me, the first allotment of Moderna this week.
Yes, sir.
Any idea in terms of when you guys are in line for some of those vaccines?
I just filled out the application for our site for those. I just filled out the application to submit to our health department on today is Monday. Thank you. I filled out the application on Thursday, and I submitted that application. So we should be getting, if I understand correctly, by next week or the week after. And they will be delivered from the health department because we don't have the refrigeration. So next week or the week after.
Are you expecting to vaccinate everybody or just a certain amount, just a certain population first?
The first 1A group, it will go to those healthcare providers who, or first-line people like nurses who want it. And not everyone is wanting it.
Quick question.
Yes, sir.
It was reported that there was one person who went to the hospital. You're saying that that's false?
One person did go to the hospital, but that was not COVID-related as it was reported.
It was not COVID-related.
Correct. It was not COVID-related as it was reported. Any more questions for me?
And when are you expecting the rest of the test results to come out?
As I left the detention center today, we just received a stack, and the administrator is now counting or reviewing those results as we speak. And we should probably get more this afternoon and so forth until we get our total numbers.
And where does it stand with staff members?
Where does it stand with staff members?
Yeah, how many staff members?
Captain Warren, would you like to speak on that? Captain Warren is coming to speak on that.
Good morning. I'm Captain Charlene Warren. I'm Commander of Operations at the Detention Center. Good morning. We have tested 210 staff members, and so far we have 0 that have come back positive. Positive. So we have no staff members, new staff members that have tested positive since we tested on Thursday, Friday, and Saturday.
And how many was that again?
210.
110.
Yes, sir.
But Mike, make sure you understand that. I don't want no misunderstanding. Since the test, make sure we understand it, because I don't want anybody to say, well, we know staff members that have been tested positive, right? Since the test last week of the 212, none of them come back positive. But here at the Forsyth County Sheriff's Office, we have several people that have tested positive.
And that number stands at 11, the last I checked, the last of the state report.
Exactly.
That's correct.
That's correct. So make sure that we delineate that we talk about since the testing.
Any more questions for?
I need to say one more thing.
Sure.
And I need to say one more thing, please. As of the 68 that were positive, 2 of those positives, out of those 68 that came, that I reported, 3 of those came into the detention center positive already. Okay. 3 of those of the 68 were positive when they came into the detention center. Okay?
Question.
Yes.
Ms. Rennie, has it been determined what the cause of the spread was?
I'm sorry, repeat that.
The cause of the spread.
So that is why we do contact tracing. So we're in the process of doing contact tracing now, determining what housing units these individuals were on, seeing who may have worked around these individuals, and seeing any commonalities that were associated with these individuals. So that is all a part of the contact tracing. So we're in the process of doing what the source was, or who may have been the source. Okay.
Good morning. My name is Rich Carlton. I'm the Major of Operations for the Detention Center. And I would just like to add, prior to Thanksgiving week, we had 4 active cases that we knew of. And those were new intakes, and they were quarantined. So the spike you're seeing, and we're seeing, and nationally we're seeing, we were warned about. We knew it was going to happen. We didn't know the numbers, but it was after the Thanksgiving weekend when people got with their families and didn't social distance or whatever. But so the spike has been recent. We had 4 prior to the Thanksgiving week. And everything is being done to mitigate the spread. We're working with our medical provider, public health. So everything we're doing to mitigate it is with the assistance and collaboration of the medical providers.
So if there are no more questions as it relates to the detention center, I'll move again into the area of evictions, the writs. Mike, there was a good story you wrote the other day. I appreciate it. It's a good story. I want you all to know that here at the Forsyth County Sheriff's Office, we take very serious anyone being evicted or removed from their house or their property. If you all recall, several months ago, downstairs, I stated how I felt about evictions during COVID and during the pandemic. I gave you my opinion that I was against it. If the records show, that's exactly what I said. I also said that I have no authority in stopping that. My opinion is one thing, the law is another thing. As a law enforcement agency, I must follow the law. During that time, we reached out to the Chief Justice Beasley, who saw eye to eye with us, and she stopped it statewide. So when it comes to evictions, now that we're having this conversation about evictions and the writs that are going on, the sheriff's office has no authority to supersede a judge. I don't have that authority. Once the order has been signed and decreed, we have no choice but to execute it. So what I like to do is I like to bring up my attorney, Mr. Albright, and let him explain the process to you. That way you have a better understanding from a legal point of view. And should you have any questions, that way we can clear up anything. And then I'd like to have a minute before we leave to share my thoughts with you on some things.
Thank you, Sheriff, and good morning. My name is Lonnie Albright. I'm an assistant county attorney here in Forsyth County assigned to Sheriff Kimbrough. Last Monday, the Chief Justice entered another order regarding, in pertinent part, evictions and that process. For as the sheriff correctly observes, he's the handmaiden of the court. He's bound by law and by oath to carry out the lawful orders and writs issued by the courts, regardless of his personal feelings. So, from a mechanical standpoint, the way this works per Judge Beasley's order is that the burden's not so much on the tenant now as it is on the landlord, you see. Because last Monday, the 14th, Judge Beasley's order, she makes reference to a form that every landlord has to complete. Now, this is on the North Carolina Courts.org website. It's AOC CVM-207. And it's called a Summary Ejectment CARES Act Affidavit. Your landlords have to fill this out. Your landlords have the affirmative obligation to provide their tenants, their residential tenants, with the CDC declaration, which essentially they're saying in that affidavit they're expressing their inability to pay their rent relative to the COVID pandemic. Maybe they lost a job. But regardless, the burden is now on the landlord. And this affidavit has to be attached to their complaint for summary ejectment or eviction. And that's the mechanics of this thing. The sheriff, is duty-bound, as I mentioned earlier, is duty-bound to carry out all lawful orders and writs of the court. Will the 12/31 moratorium be extended? Given the nature of what's going on in the United States with this pandemic, one would think that it probably would, but to stand here and say that it would is just speculation. And anyone have any questions for me? Yes, sir, Mr. Hewitt.
So, you have a writ of, the sheriff's office has a writ of possession. Right?
Yes, sir.
And they go to serve it. And that tenant presents a CDC declaration. What happens then?
If they don't have it, the sheriff, the sheriff's not involved in that end of it. The sheriff doesn't serve it.
But if they present a CDC declaration at the time that the sheriff's office is there to serve the writ of possession, does the sheriff still issue the writ of possession? Because I know that in Guilford County, my understanding is that if a tenant has a CDC declaration, a lot of times the sheriff's office won't serve the writ of possession. Is that the same policy here in Forsyth?
My advice to my client, the sheriff of Forsyth County, is if you get a writ, you serve it. You serve that
But the
writ.
writ will never be issued because what he's presenting to you goes back before the judicial official. And the judicial official makes a deciding decision as to whether or not a writ is issued. So when our guys go out there, they don't go out there to somebody possessing a CDC guideline or something like that. All that happens before we ever get the writ. And that's what I was trying to explain the other day. When we get the writ, all of that has taken place. So it's not like I show up at someone's house and they say, I have this, go away. That takes place way before the sheriff gets there to execute the writ.
Mr. Hewlett, in all likelihood, if this document is not attached to the pleading, the complaint for eviction, summary ejectment, the court's not going to issue a writ of possession because of the deficiency in not having this attached to it.
So your understanding of how this is supposed to work is if a landlord files a complaint of eviction, he is required by law to have an affidavit saying something that says that he provided this information to the tenant.
Yes, sir.
And if he doesn't, the court is not going to issue a writ?
More than likely not, because this is now,
how it's worked in Forsyth?
yes, sir. That's how it should work here and across the state per Judge Beasley's order issued the 14th of this month. And this form was just put out as well. It's dated at the bottom, December 2020. So this is all new territory because as observed by the sheriff, we're all in this boat together.
And I think that's a key point that when you take back to your viewers and your readers, that once that writ is issued, it's way beyond my control. I have no authority to supersede that. I have no authority to supersede what a judge has decreed. I don't have that authority. So while I understand, not only do I have sympathy, I have empathy. You and I talked about that last week, Michael. I understand that. But at the same time, I have to follow the law. I have to do what is legal. My opinion does not matter when it comes to the law, because I took an oath to follow the law and to do what is right. My opinion sometimes totally disagrees with what the law says. But as a sworn law enforcement official, I'm obligated to the people to follow the law and the letter of it. I'd like to start by closing by saying that the office of the people, the sheriff's office, I don't have the authority that is out there floating around that I can release people from the detention center. I don't have the authority to reduce bail. I don't make the bail. That's a magistrate issue. I don't choose health care providers. That's way out of my range. I don't even get a vote in that. So I think that we want to be held accountable to the people. But what we want is your concerns to be legitimate concerns that are directly under our authority and our supervision, that we can implement decisions and control. Some of the accusations out there are incorrect. We have no authority to do that. But what I'd like to close by saying is that we're in this together. I've said that from the beginning. This is our county. We live here. We don't have the luxury of working from home. There are a lot of people that don't have that luxury. Like you all, you're here. You're sacrificing to be here. The men and women that walk in and out of that detention center, they know going in that there are people that have the virus. But they come. And so what I'm asking is that before we allow groups and individuals to divide this community, let's gather the correct information. Let's place it at the right place. And let's have real conversations. Because while we're keeping our social distance, we can never lose our moral distance. We can never lose our ability to have conversation. And so all I'm asking is that as we go through this pandemic, and hopefully and I prayerfully that we're coming to the end of it, is that we still remain in this together. Hold us accountable. I have no problem with that, Mike. I have no problem with that. We'll be the first ones to say we're wrong when we're wrong. And we'll be the first ones to say we're right when we're right. So I want to thank you all for being here. I want to thank all of you. I hope you have a Merry Christmas. And I've said on numerous times, my door swings on welcome hinges. Anytime you need to see me, talk to me, we are a phone call away. So if all hearts and minds are satisfied, anyone have any questions before we conclude? Well, I thank you again. Have a Merry Christmas. Be safe and have a prosperous beginning of the year. Thank you.